How do we do dental fillings? So there are spaces between the first front teeth and the dentist is placing composite to be able to show the patient how it's going to look like when we close that gap. That gap is also called a diastema, which is a space between the two front teeth usually, and people don't like it and they want it to be covered. Now, how do we do that? How do we cover that area and close the gap? Is by composite. In this case, sometimes we can do porcelain veneers, and the difference between composite and porcelain is that the composite is less expensive, but also less durable, but also less invasive. Porcelain, on the other hand, is usually more work, more expensive, but lasts longer, and it does sometimes need a little bit of tooth structural removal. So there's a little chip on the tooth and the patient wants it repaired. The dentist is polishing it smooth, then separating the next teeth because you don't want the composite bonding to go and glue everything together. And then they're adding the composite using a blue light, and then voila, it's on your teeth. You would have these dental pits and fissures that can catch food and turn into a cavity. Then you need a fill. How long do composite veneers last? Usually about, on average, 5 years. They do tend to stand and chip after that, or even during, depending on how good you take care of them. But when it comes to porcelain veneers, they last somewhere around 10 to 15 years. You do need to change them a few times in your lifetime, so you have to be sure that when you pick a dentist to do this treatment for you, they're gonna do the least invasive treatment for you and the least removal of tooth structure. Sometimes we do need to remove a bit to be able to fit the veneers or make the teeth look more straight or whatever, but we don't want to remove unnecessarily and shave down teeth and not leave anything for your tooth to be there. The options to close the spaces between your teeth would be orthodontic treatment, so Invisalign and braces to physically bring them together and not need any sort of restoration that you need to change or be worried about chipping and breaking in the future. And then there's composite veneer, which is what you're seeing here, or porcelain veneer. Root surface cavity such as this can happen in people especially who do not get their teeth checked regularly. Now this cavity is quite deep. The dentist is drilling it out. So people ask us, why do you drill? Because we have to get rid of the soft dead tooth structure that's left there by bacteria. We clean it, we remove it, and we are left with sound tooth structure, with hard tooth structure that is not black like that. And then we can put a filling on the tooth, smoothen it, and save that tooth from needing a root canal treatment. Cavities such this in between your teeth only happen if you do not floss your teeth. So you do not floss, food stays there for days, weeks, and it starts a cavity and you get interproximal cavities, which is in between your teeth. Later on, the dentist has to drill them out and fill them for. How do you get such cavities in between your teeth? By not flossing. Simple as that. You shouldn't really have those kind of cavities if you're flossing regularly and you have a good oral hygiene. So there are several ways if you want to close that space between your front two teeth. One of them would be to physically put in braces or Invisalign and bring the teeth toward each other, and it'll close the spaces. That way, you don't have to add to the tooth like veneers or porcelain or composite, and that means that in the future, you have to have them changed. It's your own teeth, they're straight, that's it, they're done, although you have to wear a retainer when you sleep every night or have a physical glued-on bonded retainer. In this video, the dentist is adding to the tooth, so making each tooth a little bit fatter or wider, and that way they're closing the space. Now this is a composite bonding. You can also use different material that would last longer, such as porcelain veneer, depending on what you prefer and the cost.